Hello, hello, hello. This is Truth Be Told. This is Dr. Walter Aka.
Dr. Kyle Dumpert.
And Dr. Gary Dennis. Wagwan!
Again.
No?
Again.
No?
So you're just gonna keep repeating the same
I'm
thing.
gonna keep doing it. I'm gonna do it the whole year.
That's it. Okay, that's not gonna get annoying.
Well, you were annoyed by what I was doing before.
That's very true. That is very true. No matter what happens, I think I'm gonna just be annoyed no matter what.
That's right.
I need therapy. No, I need therapy. That's what it is. I get too angry. You know what I mean? And that transitions into a story that Gary's going to tell us.
Oh,
I thought. What do you think, Kyle? I thought that was a pretty good transition.
I think it's a great transition.
So we're gonna jump right to the grocery store.
I want you to jump straight to what you did and how anger, but the way you saved it at the end. I like that.
All right, so I'm in the grocery store, and the grocery store is packed. The parking lot is full. It's packed. You know. You're going down the aisle and like people are climbing over each other to get their pickles and their Cheerios or whatever, right? So it's nuts in the line. Like there were aisles I walked down and I looked and I was like, I'll come back. I'm gonna go find something else. It's a little too thick in that aisle, right? All right, so I get to the line to check out. I'm in front of the cashier, and in this particular grocery store, there are red rectangles on the floor, stickers to mark the social distance requirements.
That's every place I've seen that.
Yes.
Right. So
it might be yellow or what, you know.
Right. It doesn't matter.
Right.
Yeah. Everybody tries to tell you how far to stay apart. Yeah.
Yes. Right. So I'm in my rectangle checking out. Right. And then the next patron is putting their items on the conveyor, which is fine. I have no issues with that.
Completely normal.
Right? Because if you're standing at the end of the conveyor, then you are actually at the next rectangle.
So there's a cart between you two.
That's what it should be.
Okay.
But this patron decided to put the cart outside of us. So she is in between myself and her cart, and she's standing in the middle of the conveyor. So she's now
not social distancing at all.
She is half.
She's 3 feet instead of 6 feet.
Yes,
disgusting.
And,
disgusting.
You know, like you don't mess with Bubble Boy, okay?
That is your nickname.
Do not mess with Bubble Boy, right? So, and her mask was below her nose. So I was already in a state of frenzy because I'm like, this lady's too close. Her mask is doing nothing because she doesn't understand science or believes in magic, one or the other. So I'm already like, I need to get out of here, right? And I already fought my way through hordes of people in the aisles, right? I need to shower. I have people's COVID breath all over me. It's in my hair, all that, right? So anyway, so she's 3 feet, and then all of a sudden she starts to get closer to me. That's when I was like, ma'am, I'm gonna need you to step back. Can you please just step back? And then she looked at the ground and saw there was no red rectangle anywhere around her. So then she moved back to her appropriate social distance rectangle, right? Now, maybe 2 minutes went by, and I guess she was so mad that I told her to step back that she decided that she needed to have a conversation with me. So she said to me, you are so, you are wearing 2 masks and you are intimidated by me. And I told her, yes, because you are violating social distance protocol.
Wait, what else are you wearing?
I wear gloves when I go to the grocery store. All right. This is the reason.
Yes.
Right. This is the reason. I don't touch any of my stuff with gloves, right? So how about when you go to the grocery store, right? When's the next time you get to wash your hands?
When I get back to the
when I'm in the car.
No, actually, when you're leaving.
When
you're leaving, you have the hand sanitizer. That's actually when I get it. Yeah.
That's hand sanitizer is not washing your hands.
No, it's not. That's
You're just
not
rubbing
this.
dirt around in your hands.
Yes.
Like, yeah. So next time you get
It's
to wash
not-
your hands.
It's not washing your hands. You're absolutely correct.
So the next time you get to wash your hands is when you get home, right?
Okay.
All right. So you've touched everything in the grocery store. You've touched everything at the counter.
Right.
You've touched the cart.
Yeah.
You've touched your wallet. You've touched your phone.
Mm-hmm.
You've touched your car keys. You've touched the steering wheel in your car. You probably touched the door handle in your house too, right?
Yes.
So you have everybody's germs from the grocery store for the past God knows how long. Let's just say it was a day. So probably have like 2,000 people's worth of germs that you have now spread from the grocery store to your house.
Mm-hmm.
Okay.
Okay. Okay. We're following this.
For me, I wear gloves.
When
How
do
many?
you put the
How many?
gloves on?
How many pairs?
Yeah,
how many pairs of gloves?
One pair of gloves.
Okay. When do you put them on?
I put them on when I walk into the grocery store.
When
when do you take it
take
off?
them off?
I take them off. So this is what I do. All right. So
No. When do you take it off? I want to hear that.
well, there's multiple times, right? So
So you go in with a box of gloves.
no, I go in with like 5 gloves.
So you do have multiple pairs of gloves.
Yeah, but I'm not wearing them all at the same time.
No, that's what I'm saying. So you wear one, you touch certain things, and you take it off. And
Yeah.
then
So when I'm checking out,
You switch
and
gloves.
I don't touch my phone. Yeah, I don't touch my phone.
Right.
I print out my list, right, so it can be thrown away. Right. Kyle's laughing.
Kyle,
at me.
you know that reminds me of. Remember, like when your parents used to print out from MapQuest. That's
Yeah,
what,
yeah.
Oh, the directions. Yeah, that's right.
That's what Gary. He doesn't want to do anything with technology anymore. Continue, please.
All right. So when I'm taking my wallet, take the glove off. So I use my wallet.
So
then you
one
put
pair
new-
of gloves. One pair of gloves for the entire shopping trip until you're in line.
Yes.
Okay.
You got
And
it.
items are on the conveyor belt.
Yes, everything's
Okay. Okay.
yeah,
Then
right.
you take your gloves off, and then
I
you
take
put a new
one-
glove up.
one glove off.
Okay. So you
Right.
you still have a contaminated other glove in your hand.
For the contaminated stuff. That is not
Okay.
touching my wallet. That's not touching
I
my
see.
credit card. Right?
So
I
you
take it
try to
out,
take money
one-handed.
out with one hand.
One-handed. Oh, hey man, I'm an endodontist. All right. All right. All right. You see that?
This is great.
I can do it with both hands. Both hands.
Amazing.
All
Gotcha.
right. All right. So
Yeah, I hope people can watch this video. I really want them to
Right.
see what you just did.
So-
Okay.
so then I slide my card in, right? But now the strip is probably contaminated,
Yes.
right?
Yeah.
More than likely.
So my wallet is back in my pocket. I put the card behind my wallet in the pocket. The pocket is now contaminated.
yes. So you
Right.
burned the shirt later or the pants.
Okay. Wait, we're gonna get to that. We're gonna get to that. All right. All right. So then now I put a new glove on.
Uh-huh.
Now I'm ready to go to the car.
Okay.
When I get to the car, I take one glove off again.
Okay.
And the free hand opens the car, opens the trunk. Now I put another glove on. I put everything in the car. Right? Then I take both gloves off.
Do you have a special bin in the car that you put your groceries in, or does it
No,
just go in the
but
trunk?
what I do is I spray my car down after I take the groceries out when I get home.
What do you use to spray?
Is it fabulous? It might be fabulous. I think it's Fabuloso.
Fabuloso. Okay.
I think
I
it's
don't
no,
think I've
no,
ever
it's not Fabuloso. It's I forgot the
Is
name
it-
of it.
Is it like non-organic something?
It's
like
definitely not
all,
organic.
is
It's
it all
ammonia-
natural?
It's no. It's an ammonia based like odor sanitizer thing.
Oh, okay. So not like Lysol.
No, because Lysol is too expensive and too hard to find. But Lysol would be ideal.
you know the cost of gloves now, right?
Oh,
Let him go through this. This is good.
my gloves.
This is good. This is
I mean, well, the thing is, like, I never paid more than $13 for a box of gloves, but I've always paid that much. So,
Right,
like, I know
right.
people used to get like $6 boxes of gloves. I'm like, I never even used to get those. So,
yeah.
whatever. I'm not spending any more for gloves.
Okay.
Right.
All right. So, yeah. And then when I get in the car, I have alcohol wipes And then that's when I wiped down my credit card and my wallet in my pocket with alcohol wipe.
So you wipe the inside of your stuff with alcohol.
Yes.
So the alcohol wipes are good enough for all the stuff you touch personally,
but not his hands.
Not good enough to
I wipe my
sanitize the hands.
I use it for my hands too.
Okay.
What's the difference between that and
washing your hands?
Or no, actually, I was going to say the hand sanitizers.
Because you have accumulated 2,000 different people's germs on your hands.
Okay.
There's minimal.
You've done maybe like
how long are you going to keep this behavior up?
Until
what
COVID
point
is wiped off the face of the earth.
So never. So you're going to do this for the rest of your life because it's going to be with us forever.
No, it's not.
It's like it's like the flu and the common cold now. It's going to be with us forever.
It's going to disappear in June. It's going to disappear.
Again, I say the same thing. Gary for president. Because I see the same platform going on here. When it gets warm, it's going to be gone. That's going to be a slogan. When it gets warm, it's going to be gone.
I'm telling you, 11 billion people to zero.
Got you.
Very, very.
No more mutation. Listen, if you can promise me no more viral mutation, I'm voting for you.
No, yeah. It's going to mutate itself into non-existence.
All right, so sorry, we got sidetracked there. So
all right, so
back to the lady. Back to the lady,
right? So, yeah. So then,
she cursed at you. She said something.
Yeah, she called me an asshole, and then
said,
everything.
You're standing there with your two masks on and your gloves, and then yeah.
And then it turned into like a curse fest for like 5 minutes.
So you and the lady are going back and forth.
Oh, at the top of our lungs, like just cursing so loud. But it never got like I mean, it was inappropriate, but it never like it never got to the point where we were like talking about like how you look or how what I mean.
So that was
it never got personal. It never got personal.
Didn't cross the line.
Yeah, it never got personal, right? So it was just like.
You said this woman's a nurse, right?
Oh yeah, she told me she was. So my mask had my name on it, which never. I've realized I'm never going to do that again.
Congratulations.
So
now she knows you.
Dr. Dennis, you're an asshole.
Right. And the funny thing is, like, what kills me about all this is not only does he have his name on there, but he works in that area. So it's very easy to find you, Gary.
It was all bad. Yeah. It was
were
really
other
bad.
people standing there staring at you guys?
Yes, but because of the social distancing guidelines, and we're arguing about social distancing protocol, no other patrons were within 6 feet of us. But the cashier, the bagger, the cashier behind me, and that bagger were all right there.
Oh, and they could hear.
Oh yeah, they were like, oh my God, I don't get paid enough to be here.
Right.
Beep beep.
Right.
Beep. What's going on? Beep. Oh my God, these people are crazy. Beep beep. It was kind of like that. But it finally ended on some curse words. More curse words, and then I really thought that I might get arrested or get shot in the parking lot or something. Because it's Texas, everybody has a gun in Texas. But I was ready. I'd already accepted it. If that was my day, that was my day.
How did you end this?
So after I said my final curse word to her, she finally left me alone. And then after I got all my stuff, I turned to her and I said, "Have a blessed day."
Bam. Bam. It erased everything you guys did to each other for the past 20 minutes.
I think that's what saved me. I think that is what saved me.
That's what helped you, is have a blessed day.
Yep.
You cursed at her, didn't call her any name, and didn't call her by her name or anything, but you cursed at her the whole time and then said, "Have a blessed day."
Yep.
And this is normal.
That definitely was not normal for me. I haven't cursed anyone out in like 12 months.
Okay.
So that's like
so
I've been
no
waiting all
one's
year
no
for
one
this.
no
what she
one's
didn't get.
impeded. No one's
I've been waiting.
impeded.
Go ahead,
But
sorry.
Gary, so no one's actually impeded on your bubble
No.
in 12 years or 12 months. No one.
Until this. I mean, not to that point.
Okay.
Not to the point where I tell them that they are violating my space and they question it. Most people are like, "Oh, I am violating. My bad." You know.
But this nurse decided to go at you.
Yeah.
Hmm.
And she should know better. She's a nurse.
She deserved it.
Right.
Well,
Yeah.
Yeah.
So have a
Good.
blessed day.
Have a blessed day.
You always got to end it like that.
I'm
With a
gonna
smile.
start doing that. I'm gonna just curse people out and be like, "Hey, have a blessed day." Despite everything I just said to you, have a blessed day. All right.
Oh yeah, man. It was nuts.
Yeah. Kyle, don't ever move to Texas.
I'm worried about Gary. Things aren't getting any better over these past couple of months with podcasts. It's things keep escalating with him.
Oh,
and
soon we're gonna be I'm gonna be bailing him out of jail. Like
one of these guests, we're gonna have to have a therapist or something on here. We're to have an intervention for Gary.
It's funny. They talk about how like the COVID is affecting kids. Well, there should be this whole section that talks about how it's affecting Gary. That could be a nightly news special.
Oh man!
And they just record his day. They be like, look at him, look what he's doing. Look at him. This is so sad.
Have you ever worn your full suit, respirator, everything out in public?
No, but
that's crazy. That's crazy.
I'm going to do
it. That's where he draws the line.
I'm going to do it one day though, just to scare people. Like I'm going to go to the grocery store when it's packed with all that on and see what happens. They're going to be like, "Sir, your groceries are free. Just take them and leave."
Have you ever seen? There's like pictures of like what crazy stuff people wear to like Walmart.
Yeah.
Mm-hmm.
Yeah, Gary's gonna make it on there.
Yeah,
he's gonna make it like where people. Gary's gonna definitely make it on there, and if he does, he's gonna go viral. I promise you, he's gonna go viral. Just make sure that you rep the podcast, Gary. Just support us. Actually, no, never mind. Don't do that. I take that back. Don't do that, please.
Oh man.
We don't even know if we have people listening, but they're definitely gonna be like, "What the hell? He's a part of this?" We're definitely not listening.
We don't know him.
We disavow him completely.
We said he was going crazy. We said it on the podcast.
Oh Jesus! Well, so do we have any dental talk? Anything to talk about? Anything at all?
So as I mentioned before, one of my assistants quit on me a while back because she had childcare issues.
Right.
So I have these backup assistants that come. So this week I had one assistant who I almost told to go home and never come back.
Like I did with Thursday.
Yes. And matter of fact, no, this was a Friday.
Oh, so Friday.
Yes.
You almost told Friday to go home.
I almost told Friday to go home. So I'm in treatment, and I don't allow Friday to work chairside with me. So I have my amazing main assistant working chairside.
Right. Okay.
So I am giving verbal instructions to the patient about the treatment or whatever. And Friday walks into the room and just says, "Take a deep breath." And I'm like,
Wait a minute. Hold on. Let's pause. What was the patient?
No.
Septic, or was the patient
no,
hyperventilated? Was the patient anything?
No, I am putting the rubber dam on, and I'm telling the patient, with the rubber dam on, you're going to be able to swallow as normal, move your tongue. If at any point you feel like you can't swallow, just point to your mouth. I'll give you some suction.
Makes sense.
Take a deep breath.
So this was not provoked. She didn't see any need
No.
for it. The patient wasn't
It
dying
was
at any time. Gotcha.
Completely erratic and senseless. And even like and even this patient's like, what? Like, what? Yeah, I'm like, yeah, let's just keep going. Whatever. Right. So then I accessed the tooth, and she had an infection on the tooth. The tooth was necrotic, nerve is dead, and it was like wet necrotic, if you know what I mean. I don't know. You guys do root canals, you know what I'm talking about, right?
Yeah.
So she had a lesion on the tooth too, right? So it was a maxillary tooth. So in the palatal canal, when I was getting patency, she could feel it. I was like a millimeter out. She could feel it, so I gave her some more anesthetic. Now Friday is standing behind my other assistant in the room at this point.
So she has nothing to do.
Yes, there's nothing to do, right? Just might as well watch it, right? So I give her some more anesthetic. Go in the palatal canal again. She said she can feel it again. So I give her some more anesthetic. Then Friday says, "Hey, doc, isn't it the same thing that happened on that other patient?"
Oh,
Right?
no.
Yeah. And I like one, I didn't even like, I don't think about stuff like that. So, because if we finished the treatment, then it was all good.
Right.
So I just said, I don't know what you're talking about. And no, I said, I surely don't remember that. Thinking that after that point, she would shut up.
Yeah.
No. She says, "You remember? You know that patient, palatal canal, there was a lot of pain." And I was, and that's when I was like, I don't know what you're talking about. And then my assistant was like, I could see, like, it was like, that means shut up.
Shut the F up for life.
Yeah.
So she's not good with like social cues.
Oh my God, no. And then the other thing, I'm like, do you hear my assistant saying anything in the treatment? Ever? No. Like, so that, like, it wasn't just that she did one of these two things. She did that and was yelling out, "Take a deep breath." Like, it was just accumulation. I was like, this is a problem. So I finished the treatment. My assistant can see the fumes coming off, like just heat coming off of my head throughout the treatment. But I didn't, I wasn't gonna like bang on her in front of the patient, because then the patient's gonna be like, "Oh, Dr. Dennis is an asshole," So I just, all right, cool. We're going, let's get the Sade rolling, and we're gonna finish the treatment. Finish the treatment. Patient's happy. So then I was like, I could bang on her in front of my other assistant, but I'm not gonna do that, because then that's kind of an asshole too. And then my other assistant will be like, "Dr. Dennis is an asshole." So I'm like, I can do that. So then I had to wait till I got her alone. So I got her alone, and then I told her, I was like, "Look, don't ever do that again." And of course, she's like, "I don't know, what are you talking about?"
So she's playing dumb too.
Yeah.
So is everybody just playing dumb.
Yeah. And I was like, "Look, you do not talk about a patient's treatment in front of another patient, right? You just don't do that, right?"
Yeah.
And I said, and she was like, "Well, what do you mean?" I was like, when you were like, "Oh, that patient's in, didn't that happen before another patient?" Like, well, I did say it like that too. Like kind of.
So you're mocking
in a mocking way. Yeah. And then she was like, "Oh," and I was like, "Not only do you not talk about another patient's treatment in front of another patient, you don't say this type of stuff in front of the patient, because it's making me look incompetent to the patient."
Exactly.
Like, "Oh, this guy can't get palatal canals." No.
Right.
Like, what are you doing? Right. And then I was like, don't ever come in a room and just start yelling out things when I'm giving verbal instructions to the patient. It's distracting. It's annoying. It's confusing to the patient. That's just something we don't do.
Yeah.
And then while I'm like, and I'm saying this somewhat aggressively.
No,
Right.
not at all.
So out of character for you. But continue.
And then my other assistant is walking in and I was like, "Ooh." So then I was like, And I was like, look, I'm sorry for getting loud, but like this is stuff we don't do. And she was like, no, you're right. I deserve it. And I was like, okay, all right. And then my other assistant, and I walked out, and my other assistant, my amazing main assistant, she came over to me and she was like, I was going to say something to Friday. But I was like, nah, I got this one. I got this one.
Let me finish off the week with more aggression. not only do nurses get my wrath, my assistants will as well.
Well, see, the grocery store was Saturday though.
So this actually was one of the. So maybe Gary, maybe your anger was not completely done, and you projected it onto the nurse.
She primed
the next day.
Yeah.
So you should have said, God bless you to Friday. So therefore you would have ended the anger.
Well, see, here's the thing. I apologized to Friday. I apologized to her for my part about how I handled what she did and how I spoke to her about what she was doing. And I also apologized to my assistant as well because she heard it. So, and I told her, I was like,
have a blessed day. That you didn't end with have a blessed day.
That's it. I think that's really what ended up.
That's what it was. That's probably what it was.
So the anger was still there. The blessing hadn't come yet because you had not, spoken into existence. So the next day, you had not been blessed yet. It was basically the devil speaking.
It was. It was the devil. It was the devil. He got me.
It's okay, Gary. This could happen to anyone.
Oh, and check this out. So, two of the dental corporations that I work with, both of them messed up my 1099s. Both of them, right? Because it's tax season, trying to get my 1099s.
You're trying to get it
right.
Mm-hmm.
So one of the company, I asked, I'm like, where are my 1099s? When can I get them? How can I get them? And they're like, oh, we don't have any for you. Exactly. And I was like, I've been working with you for 6 months. And I had also sent my W-9 in 3 times because one person had it and they didn't transfer it to this person and transfer it to that person. 3 times I sent in my W-9, right? So they said they had no 1099s. I told them that I'm sorry. This is what I wrote in the email. I said, I'm sorry, but I just don't have time to deal with incompetence.
What day was this?
I think that might have been Wednesday.
There it is.
Okay. All right. We're getting to the root.
This is all coming about. Now I understand why the nurse got it.
She got it. Yeah.
I get it now. Okay, keep going.
Yeah. And I was like, look, I just need my 1099s. I've been working there for 6 months.
Okay.
And then 2 hours later, guess what? Magically,
1099.
I have my 1099. Yeah, magically, right? Then the other company. So the other company is structured so that it's not one 1099 for the company. It's each office has a separate contract. So there's a 1099 for each of the offices that I go to, right?
Mm-hmm.
So they sent me my 1099s. They were wrong. I was like, hey, these are all wrong. So they sent me a new batch. They were right, except for one office was missing. And but it added up, right? Because there was like some magical 1099 from the company and not from the office, right? So the numbers matched, but the 1099s are not right. So I told them that these still aren't right. So then they actually sent me their accounts payable ledger, an Excel document of all my payments that I've received throughout the year from each office. And they said, look over it and tell us if you find any discrepancies. In about 30 seconds, I found the discrepancy. So what they had done was there's one office, they had actually separated it and made it 2 offices. Gave it 2 different names. Right?
Oh.
Right. And then what they did was they created a 1099 from the company, but not from those offices. And I was like, look, your numbers are correct, but your documentation is completely wrong. You have an office listed twice here under 2 different names. These are the same office. So, and I was like, this is actually simple. I wrote in the email, I was like, this is actually just simple accounts payable. You know,
Right.
like you can teach a 13-year-old how to plug in these numbers, and it's Excel. Like it adds it up for you. Like the formula is already in the document. Like, you know. So then, of course, they replied back, and they were like, "Oh, you're right. Here is the correct 1099."
So
And
you
I wanted to be like, "Here's my bill for doing your job."
Right.
I'm like, man.
Right.
So that's how my week was, man. It's crazy. Crazy week.
I can't match that, Kyle. My week was very basic.
I have one patient that comes to mind, and it comes back to something I think we've talked about before with when do you push the envelope as far as treatments that you do, and when do you stay in your safe little bubble and not worry about things. So new patient comes into the office. She was a public assistance patient, which I don't accept their I don't participate with that. And the front desk told her, look, we don't participate, but you're more than welcome to pay cash. She said, that's fine. I just need to have a tooth out. So she comes in, assistant gets the x-ray, comes and gets me and says, you know, this woman is sitting back there. How do you do with crying? I said, I don't do good with crying at all. Why? Well, she's holding her face. She's crying. All this stuff. So I said, okay, walk in the room. As soon as I walk in the room, her hand is just holding her face. Mm-hmm. What brings you in? I broke this tooth off. Okay. When did that happen? A couple of months ago. And she said,
it wasn't important until now.
Well, she tried to get it taken care of because she said, you know, she's been on a couple of different antibiotics. She usually gets treated in a hospital setting because the local anesthesia doesn't work on her or anybody in her family, which they're just red flags in my mind.
Yes.
Local anesthesia is going to work.
So they're magical people. Elves?
Right. Yeah.
Fairies?
She gets put to sleep for everything. Which,
there it is.
So she said, I've called everybody. I don't have an oral surgeon in my town. Closest oral surgeon's 40 minutes away, and it's probably about a 6-month wait to get in to see an oral surgeon right now.
So for anybody listening who's an oral surgeon, you just come to how to make a lot of money.
Come to Bedford.
Yes. You don't have to even live there. You can just go on your vacation home every weekend.
You really could. You really could.
You will make that much money.
I take out a lot of teeth in my town, and I get referrals from the other general dentists. The only thing I don't touch is third molars because VA training, you don't see a whole lot of third molars. Anyway, so I'm looking at this tooth. She only has 3 teeth left in her head, her 2 mandibular canines and 1 premolar. The premolar was what was broken. And she's been up to State College, Pennsylvania, hour away. She's been out to Pittsburgh. That's 2 hours away. Nobody can get her in until June. She's been on antibiotics. Her family doctor wrote her a prescription for lidocaine. I said, what? With the e-prescribing that we talked about before, e-prescribing, one of the benefits is I can look up or put their pharmacy in there and see everything that they've been prescribed. So her family doctor gave her a prescription for topical lidocaine, which is absolute garbage for a toothache.
Right.
He was just trying to get her out of her hair.
Right.
So I'm looking at her as well. As she's talking to me, she's saying how sick she feels. She's burping, like indigestion, feeling like she's going to throw up as she's talking to me. So I start hearing Gary in the back of my head.
Where your bubble? Where your bubble?
Did they take your temperature when you came in here? Yeah. So ask the assistant, "Did you guys take her temperature when she came in?" Yeah, it's 97 something. Okay. The woman said, I checked my blood sugar. It's over 300 or something right now. She's not feeling well, but she checked her temperature last night. No cough. She's just feeling very sick, probably because she's pounding Tylenol and ibuprofen to try and get rid of this pain.
Right.
So I decide, this woman's telling me, 1, she only gets treated in a hospital. 2, uncontrolled diabetic. 3, history of not being able to get numb. 4, physically she's not feeling the greatest. But as a doctor a patient is coming in to see you that is in pain, needs help, can't be seen anywhere else.
Right.
At this point, I make the decision I need to take a risk on this lady and do my best to get her out of pain. So she agrees to have the tooth taken out, go to number up, leave the room, go up to my front desk and say, I said to my front desk girl, if I say your name, call 911 because this woman might die on us because of how she's looking and feeling right now.
Right.
And went back into the room, 5 minutes later, checked her, completely numb, popped the tooth right out, sewed her up, and she was on her way. She was fine. Everything turned out great with her. She was extremely thankful for being able to help her. So I don't know how she's been treated in the past by other dentists and why she feels the need to go into the hospital. But in my mind, she's perfectly capable of being seen. But it's one of those times where you felt good to be able to get somebody out of pain.
Well, but here's a
That's
question.
a good story.
Yeah, it's a very good story. But I feel like she kind of set herself up for failure by telling you all these things. Like if it were me, I'd be like, look, and if I was busy, I'd be like, I don't have time to deal with this. Like you're basically telling me from before I even touch you, you're gonna fail.
Right.
Like how are you supposed to act today? Like you basically acted opposite of what you should really have acted like, right? You should have been like, oh, she's already giving me all these signs. It's kind of like somebody coming in and be like, hey, I'm gonna stab you. Mind you, I'm gonna stab you, and then you're like, nah, they're not gonna stab me.
Yep.
We give you enough warnings, you know what I mean? So you basically you acted contradictory to what you should have. But that's great, man. That's a great story.
Yeah, I'm glad that it ended well. I don't think I would have seen that patient.
Yeah, I didn't,
exactly.
I was 50-50 on whether that ambulance was actually going to show up or have to be called. I was nervous on that one. But like I said, everything turned out good. I haven't gotten a phone call from her since, so she's doing awesome. Great as far as I know.
Yeah. That's awesome.
That's definitely a good doctor story. I like that story. Positive doctor story. Yeah.
We spent 30 minutes on Gary's hatred towards people. This was good.
I bet, you know what? I bet she told you to have a blessed day.
She did. See?
You see? That's what it was.
There it is.
That's what it was. Yeah.
Well, actually, Kyle, I want to ask you this because I know a nor'easter just hit your area, right? Did you guys have a nor'easter again? Like how do you do with your office opening and just basically trying to accommodate for people that may have emergencies when there's a blizzard or whatever that just happened?
Yeah, I can get to the office. It's 5 minutes from my house. Last week we had an ice storm that came that it surprises you who shows up on the schedule. When we had the ice storm, there was only 2 cancellations that day. And the people that show up are not the young, capable, what you think would be capable people. It's the 70, 80, 90-year-olds that will brave anything to get to their appointment. And they're waiting at the office, or they get there 45 minutes ahead of time. They give themselves time to travel. But if it's a younger person, if the sun's shining that day and it's a nice day, they'll say, I don't feel like going to the dentist today, where a lot of the older population will show up. So I go to the office and it depends on how bad the storms are, but most of the time most of the people show up unless it's real bad. And if it gets to the point where I'm concerned staff isn't going to be able to make it home safe, if it's hitting mid or afternoon, then sometimes I'll have them move some patients around and close the office a little early.
You know, it's actually funny that you bring that up because when I was a resident at the VA for 1 year, it was a time where we had a blizzard.
Mhm.
And I called the director, like I want to say I called him like 5 or 6 in the morning. And I was like, hey, you know, the blizzard hit, like it's crazy. I'm guessing we're closed, right? He goes, what are you talking about? And I was like, yeah, you know, it's a blizzard. My car is stuck and you know, no, the roads haven't been plowed yet. Like we're closed, right? He's like, what are you talking about? You better get up here. Your patients are going to be waiting on you. And I was like, oh, get out of here. Mind you, we see like older veterans, you know what I mean?
Yeah.
So I clean my car off. I find a path to get up there. Mind you, the VA was up on a hill.
Mhm.
So I'm scared. And I'm like, oh my God, like you put sandbag in the back of your trunk and just so you don't like skid out and die. You know, so I finally get up there. Sure enough, man, there was like 4 or 5 people sitting there talking about, hey, thank God you showed up. I'm glad you showed up. Give me a hard time for being a wuss, for even being scared for my life. He's like, welcome. You know, they've been there for like an hour, giving everybody that walked by a hard time. You know what I mean? So that's how I knew, like, older people, man, they don't care. Their whole life is done. They've lived their life. They're like, look, you know, I mean, whatever happens, happens.
Mhm.
You know what
Yeah,
I mean, every single time they don't care, man. They will get there.
they've been through some tough times, and a little bit of snow, a little bit of rain, a little bit of ice is nothing to them.
Right? You're a wuss if you even consider like canceling your day.
Yeah,
You're like,
yeah.
what? Get out of here.
Yeah.
Do you know about Nam? And I'm like, okay. That's a bit aggressive, but okay. You know what I mean? So yeah, man. But no, it's actually they're the best to like just deal with because they give you such a hard time just for being so soft. You know what I mean? They're like, 40 feet of snow. I remember back in my day. You know what I mean? You know what I mean? I used to walk in that. Okay. All right. Thank you, Mr. Smith. Can you sit down now? You know,
I had to ride a horse through it, and my horse died, and I had to carry my horse the rest of the way.
Right. You know what I mean? I'm sitting here complaining about like 12 feet of snow. How dare I? But it was a good day. But I guess we'll just leave it here, guys. We maybe we'll come up with topics or something another time. I think Gary entertained us for a while. I'm not gonna lie to you. I wasn't expecting your story to take like half of the podcast. And people are gonna be like,
I didn't either.
This man is angry, and it all goes back to Wednesday. So Gary, you gotta just stop wearing the mask that has your name on there.
Oh,
I don't even know why you thought that was a good idea, to be honest.
Yeah, that was not a good idea. Yeah, definitely not going to do that anymore. And I know, like now, I'm just going to, like what I tell my daughter, like just take a deep breath, count to 10.
So someone interfering in your bubble is going to be.
It's going to be okay.
You're going to handle it differently.
Yeah, I'm definitely going to handle it differently, especially in Texas, man. Like you never, like
that is true.
You might not make it home. People are crazy out here.
Very, very true. I just think that it's been a whole year, and you haven't changed the way you deal with the COVID situation. Like nothing's changed, and it's amazing to see. You know, with as much stuff, you are still like as vigilant.
Well, it's
a good
worse
word
now than it was.
You know,
like, how can you be more lax?
No, I'm not saying be lax. I just think that with more information, you will be able to. Well, yeah, I guess be a little more lax. Yeah, you know. But yeah, you know, maybe Gary's doing the right thing, and we're the crazy ones.
Okay, all right, okay. Time out. Okay, so what was that?
Let's just say I don't wear 2 masks to go grocery shopping.
All right, so 3 months ago,
let you know that.
Like 3 months ago, when I said people going to Mexico are getting COVID. Right.
We thought it was very xenophobic of you, but yes, go ahead.
And I was like, they should be quarantining when they come back.
Well, you said everybody that goes to Mexico comes back with COVID. That was your statement.
Yeah, so they should be quarantined. So there should be a mandatory quarantine. And then what, Kyle? You said last week the CDC said, hey, people going to Mexico.
No, they didn't.
They should be quarantining.
They didn't say that.
So, out of the U.S. Don't do that.
All right. So, well, no, but they said Mexico.
That's how we get canceled. Don't do that.
Yes, they did. Yes, they did.
They said anybody going out of the country.
Which is Mexico's out of the country.
Yes. Right? It happens to be one of maybe hundreds.
All right. So,
other countries in the world.
Well, it's one of the only countries that allows Americans to go to right now.
Yeah, we still.
It's a small list. Yeah, it's a small. I'm not sure
Canada.
about that one.
But
Oh, Canada?
Canada hates us right now. So
I'm not. Yeah, I'm not sure. But so that's more information about stuff getting worse, right? Then Sanjay Gupta on CNN last week says you shouldn't be wearing just face coverings. If you go out, you should be wearing a KN95 or an N95 with the new variants of COVID, right? That's some more information about stuff getting worse, right? So
Gary,
more information,
but it's been getting worse for months.
Every day it gets worse. Except the one positive thing is that 49 states had fewer cases this week than they had last week, and that's the first time that has happened in like 10 months.
Yeah, because we got through the holidays and you got through that post holiday gathering bump.
Right. And the vaccine helped.
Yeah.
We can't forget the vaccine part of
it. The little sprinkle of vaccine they're sprinkling
a little bit
over just a tiny little bit.
It's helping because now people are actually a lot more. Now people are going through their second phase, which I'm still nervous about because I haven't gotten that yet. Like this, I should hopefully next Saturday. I should hopefully get my second. And I say hopefully because we still don't know if we're gonna have this is gonna happen. By the way.
Yeah, I'm supposed to get mine on Thursday, and I don't have an appointment. Like, I don't think it's gonna happen.
All I know is if I see an old lady, I'm doing what Kyle did. I'm pushing her. Yeah, I'm getting my shot.
Survival of the fittest, lady.
Right.
Get out of here.
I'd be like, you know what,
you've lived your life.
Remember Nam?
Yeah, right. And then and that's when she trips you with your cane, and she was like, "You're soft." You're soft.
All right. Well, I mean, I don't know. I just think that I think that the fear part of it, at least for me, I'll speak for myself. The fear aspect is kind of diminished a lot because I know how to basically take care of myself.
I'm not afraid. I've never been afraid.
Compared to like April, May.
Kyle, go ahead.
I was nervous the first two months of it.
Yes,
I was nervous because nobody knew about it. Now I'm fine. I don't wear gloves when I go to the grocery store. I don't wear. I keep the same mask on the dash of my truck. You wouldn't like being around me, Gary. Let me just put it that way. Before I incriminate myself.
Kyle, you see that square on the floor, right? You stay in your square. Okay.
Kyle's gonna go like hug Gary. Hey, come over here. You're gonna see Gary's head explode.
I'm still relying on the good old immune system. Eat healthy, exercise, and I'll be fine.
Kyle goes to the hospital. He's like, "Where's the COVID ward? Let me walk through that. Let me just walk through that real quick. I need a boost for my immunity. Bring it on. Find the sickest one. Bring it."
I say, but the only time I was scared was for that 1 week where there were no protocols. Back in like early March.
That was like 2 months. There was no protocol. Like everybody kept changing their mind. It was like,
I stopped working for 2 weeks.
Okay, well, there you go.
Right.
Yeah.
So that's why I was like, until there were some protocols, So, but that was the only time I was scared. After that, like, I take all the maximum amount of precautions. So I have no fear because I'm in a bubble, and I tell people,
stay out of your
bubble. My 6 feet.
That's right. You do realize, and I'm going to say this, and Gary, I hope your mind does not explode right now, but there is no scientific basis for that 6 feet. You do realize that, right? They've shown that it could travel indoors up to 13 feet.
Yeah, I was going to say it's like 13. Yeah.
So I pray to God I didn't mess your whole year up.
No.
Gary's not working for a whole year.
Well, because if I have on a mask and they have on a mask,
right? Like
they really would need to be like yelling and cursing at me in the line of the grocery store for that to actually travel that far.
So basically, what happened is what
You put yourself at greater risk.
Yeah. Right.
Well,
Right.
I think we should end it there,
Yeah.
so that people can listen to this podcast and go, "These guys are completely idiots," and and I have learned nothing today, so that's good. We have officially done a whole podcast where we didn't teach anything at all.
I think you're right.
We've set a record, guys. This is good. This was incredible. Well, anyway, let's just end it here, guys. I absolutely enjoyed this podcast. It made me laugh. I needed a good laugh with everything happening. So this was excellent.
Until next time, guys. Have a blessed day.
Have a blessed day.